Thank you very much, everyone. Welcome to our Genomic Sequencing PSCM CoP session number 6. We are having today, 28 May 2025. Our title today is Bridging the Cost Divide in Genomic Sequencing, Actionable Strategies for Manufacturers, Suppliers, and Users to Achieve Affordable and Equitable Access. This is going to be the outline of our agenda. I'll give a few remarks. We are going to have the main presentation from Mr. Newton Runyowa. We'll also have discussions and feedback from all of us, including our secretariat picking some key items for follow-up and next steps. It is our honor and pleasure to have you around today to discuss this important subject about the equitable access to genomic sequencing technologies, which we know is a relatively new technology, which definitely comes probably at a higher cost, and we still have a few countries and research institutes which are still in the process of procuring some. But we thought that it was important to discuss this subject using the experiences that we have had so far, so that for those who are still preparing to have the equipment and the technology, they will also get something. So today, we are privileged to have with us in the house, Mr. Newton Runyowa. Mr. Newton Runyowa, whom I'm going to introduce now, is a seasoned expert in medical laboratory services and health system strengthening. He has got over 20 years of diverse experience across public health, private sector, and clinical research settings. He holds formal trainings in medical laboratory sciences, field epidemiology, health information management, procurement, logistics, supply chain management, and development practice. Newton's career spans hands-on laboratory work, technical support for national health surveys, delivery of high-impact technical assistance for the implementation of Centers for Disease Control US and USAID-funded health development programs. He has also provided international business consulting services, supporting health product manufacturers with market shaping and access strategies. He has worked with a range of organizations. I see here the Ministries of Health, private medical laboratories, the US Centers for Disease Control and Prevention, Crown Agents, the University of Maryland, Baltimore Center for International Health, and Market Access Africa. So currently, Newton leads the business development office at IMC-Africa. IMC-Africa is a Pan-African consulting and advisory firm, which is headquartered in Botswana. Ladies and gentlemen, this is the person who is going to be presenting to us on this interesting subject. Over to you, Mr. Newton.
Thank you very much, Nyasha, for the kind introduction, and warm greetings to you all colleagues. I'm happy to be part of this session. Thank you. To kick off this session, over the next 10 or so minutes, I'm going to share with you a few insights around this important topic. And equity and context are key principles in global health, and I'm excited that this session is anchored on those two principles. As mentioned in the introduction, there is a high-cost challenge that is associated with genomic sequencing, as explained by Nyasha. And we also are aware that because it's a new technology, our testing volumes are still relatively low. And we are aware as laboratory professionals that test volumes are a key determinant in the overall cost per test. However, there are other critical factors. And in this slide, those factors are highlighted through a framework that was developed for building sustainable laboratory services. And this framework was developed by the US Global AIDS Program led at that point by Deborah Becks and John Kengasong. And I hope some of these factors will become evident in terms of their contribution over the next few slides. Thank you. Next slide, please. So this slide is our case study in this session today. The two graphs. The top graph shows the testing trends over time for CD4 and viral load. And we might be aware that these two technologies were introduced around the same time. And initially, CD4 was recommended for ART treatment initiation, and that resulted in an increase in the adoption and use of this technology. And over time, at some point, there was a global recommendation that viral load be used for ART monitoring. And at that point, we saw a rapid increase in the number of technologies that were introduced for viral load testing, and also the resultedly an increase in the total number of tests that were being performed. In the graph below, we see the relationship between the adoption and use of viral load and also the average cost per test for viral load. At some point, you will see in the red graph, the test for viral load was at a highs of around $150 per test. And at this point, the total number of tests that were being performed in viral load were relatively low, which meant the associated costs of the technology, the reagents, the consumables, service contracts was also at very high. But with the global recommendation to adopt viral load for ART monitoring, we saw significant PSM-related innovations that resulted in a rapid decrease in the average cost per test for viral load, now averaging around $10 to $12 per test from highs of around $150. Next slide, please. So what worked? What has worked? We see, or we have seen, the previous slide, thank you. So what has worked? We have seen that multi-stakeholder collaboration is critical and has resulted in some key innovative PSM innovations that have delivered greater access to these diagnostic technologies. Primarily, policy adoption or policy endorsement has been critical. When the global HIV program recommended that viral load be used for ART monitoring, that led to global adoption and utilization, and also resultedly in governments adopting this technology and scaling up this technology. What other actions have worked? We have seen also market shaping and market access initiatives that have been introduced also within the HIV program. We have seen an early market access vehicles being implemented for the VCTEC CD4 test and also for HIV self-tests, the blood-based ones. What is an early market access vehicle? This is a demand-driven market intervention that is used to overcome market barriers to facilitate technology adoption and usage. What also has worked within the HIV program, as we have seen, is the development of all-inclusive testing services agreements. And these have resulted in the sustainable scale-up and coverage of viral load and EID testing. And in these agreements, the cost of the technology, the reagents, the consumables, supplies, repairs, maintenance, service, training, application support, they are all bundled together. And the end user will pay for all these services through a single cost per test. What else has worked? With the increasing volume of PCR tests that are being done, we have also seen manufacturers now launching vendor-neutral consumables and supplies. And these are critical because it also provides the end users with flexibility and also leads to potentially reduced costs, as you can be able to use PCR tubes across multiple platforms, for example. What also is working, as we can see, is the interventions that are being implemented through the PGI, where there's a rapid development of multi-sectoral, multi-stakeholder strategies. There are costed implementation plans and also frameworks for expanded use for genomic sequencing, and also the development of target product profiles for specific health conditions, which are going to help manufacturers to understand the expectations of the programs and the end users, and also to develop relevant programs. We have also seen the Global TB Program recommending targeted NGS for TB drug resistance surveillance, and this has already led to development of new tests, and they have recommended some tests, and this will potentially lead to also reduced cost and also improved access. Next slide, please. So what can work in the context of genomic sequencing? We identified about 6 strategic opportunities if we look at the NGS workflow. However, we only focus only 3 of them. One being, we do have a significant install base. There is value in seriously considering a policy recommendation for adoption of NGS for routine use within the public health space. And this will serve as a motivation to manufacturers to scale up their development pipeline for IVD-ready tests that can be deployed. And we can also leverage on the expertise and that research and academia already have in genomic sequencing to advocate for this policy adoption. So policy adoption is one of what can work in terms of bridging the cost divide. What else can work in our context? We do need sample to result solutions. Currently, there are no turnkey solutions for NGS workflows. And the solutions that can package all the discrete elements of sequencing workflow into a standardized complete solution, from sample collection to data analysis and interpretation. And these sample to result solutions would maybe be similar to the all-inclusive service level agreements formats that we have seen in the viral load and EID space. And we are aware that some manufacturers are already working towards some of these solutions. And maybe this is where the early market access vehicles can be implemented. What else can work in the NGS space? Food procurement. Given the current use cases for genomic sequencing, and we admit that the total volumes are still low, and against the testing capacity that we already have post-pandemic. And learning from the management of other health products, food procurement can help reduce the costs. And most importantly, food procurement will help to improve the visibility of data for all stakeholders. We are aware of the challenges that we have in terms of accessing real-time data to understand what are the testing plans that country X has, what is the budget envelope that they have at this point. But when we are implementing a pooled procurement mechanism, there is increased visibility of data, and it can allow all the stakeholders to understand what to expect, and also some of the scenarios that we see currently, where some products are being manufactured after an order has been placed. They might evolve as there will be more data that is visible. So pooled procurement can result in increased volumes and utilization of the currently available install base, and also might also result in other key innovations like pooled testing, where specific testing programs are supported to improve the number of tests that they are conducting, and inherently might result also in the reduced cost per test because of the increased volumes. So those are the 3 considerations that can work. And these are the few insights that I wanted to share with you. is setting the context for the wider discussion that is going to take place. Next slide, please. So thank you very much, moderator. I will hand it back to you. Over.
Thank you very much, Mr. Newton. We really appreciate your insights. And I would like to once again welcome all participants who have joined during this session. We really appreciate your presence and your input. Silva, you can forward me if we have questions that we have received so far. You can forward them to my inbox. Meanwhile, allow me to present this summary where we are asking people in the House to contribute to some of the summaries from the presentation that we had been sent by our presenter to see how at a global or regional level, the policy and financing as well as market access could influence it going forward, even at national levels for the manufacturers and distributors, maybe any business insights and technology innovations from the challenges that we have received so far. If we can have some vendor neutral consumables that can be used across different machines. And of course, the lab users, whom I know there are a lot in the House, at operation and tactical level, what have you been experiencing with these gene sequencing equipment? Are they affordable? Do you have the resources? And what do you think should be done apart from the insights that have been presented? So I was checking in the House who is in for us to receive some insights. Do we have any manufacturers who are in the House who could have a take on this subject? Any suppliers in the House? You can raise your hand.
Yes, Nyasha, thank you so much. We expect to have colleagues from Illumina. Maybe we could call upon them to give us some insights on some of the potential actionable solutions. Thank you.
Thank you. Yes, you can go ahead if you are in the House. I was looking for Dr. Bridget. I can't see her, but I think there's Vivi.
So yes, Nyasha, at the moment, we don't have questions in the chat. Maybe we expect colleagues to make contributions. Thank you.
Thank you. While we still wait for the suppliers, we can open the discussion to anyone in the House for their input. Please feel free to go ahead and contribute to the subject. You want to break the ice, Trevor?
Yeah, I'm happy to break the ice and get the discussion going. I know that you presented a number of important concepts there. Some of them may be familiar to all of us here. Some of them may be new. But I can say that I think just this experience that we've seen with molecular or PCR-based diagnostics, say over the past decade or so, with the introduction of and scale up of viral load, for example, and the various changes or alternative procurement models that have been explored there and have been introduced, has been quite transformational. So I think the slides you presented illustrate that pretty well. And the points you made about how by structuring and procuring in a particular way, changing the way that procurement is done, it has benefits, for many stakeholders, for both for both the buyers, the labs, the ministries of health, for patients, of course, because there's the more reliable test availability and instrument uptime, and also for manufacturers and suppliers, because there's the market becomes more certain, more organized, and less and more predictable. And so the question that I think we need to ask ourselves is, can we achieve the same thing within genomic sequencing? Is this feasible? We know that there are some similarities between genomic sequencing and the way that sequencing is done with PCR testing. Both of those assays require an instrument. They both require maintenance. There are some capital costs there. There are ongoing costs of maintaining the instruments, and sometimes maintenance is not always procured. We know that there are reagents, and there are a number of different reagents and suppliers and third-party suppliers as well. So there are some similarities in terms of the components that need to be procured. But there are also a few differences. I think right now genomic sequencing is still at an early stage of its adoption. And while PCR testing, when these new alternative approaches were being implemented, was also at an early stage of adoption, there was a clear direction for how it could be scaled up, or how it should be scaled up. And I think within genomic sequencing, we need to look more carefully and try to understand what the use cases are and what the need is, and how genomic sequencing could expand. We know it's a very powerful tool. We know it has lots of utility and applications in outbreak, in surveillance for epidemic-prone diseases, in outbreak management, as well as in clinical use. For example, genomic sequencing is now a recommended approach for diagnosing drug resistance within TB patients, and so there's some real applications there, and it's also used in research. But I think right now there's there's not enough probably clarity and understanding about all the uses, or should I say general understanding across all stakeholders as to what all the uses of genomic sequencing could be. And there maybe is not a sort of common vision of where genomic sequencing could go and how it could be applied and how it could be more broadly used. And I think that could be something that I think is good to discuss as well, so that we just as a community, we can truly understand the broad utility and how the utility of this technology and how it could be and how it could grow, because that I think would help us understand the overall demand, and then the overall sort of market that will become clearer. And it becomes easier when you understand what the market is, and it's much better defined. It becomes easier to have discussions between buyers and suppliers about what can be provided. So let me just share those reflections, just to sort of advance on your earlier presentation, and highlight some of the opportunities and also some of the needs. But I'll pause here and just see if there's any reactions, if anyone wants to come in and share their perspective, either from the buyer's side, labs, or folks who are actually procuring genomic sequencing and their experience and what they think can be done with more inclusive pricing, and also if any of the manufacturers who may be present to share their perspective or their experience.
Thank you very much, Trevor, for those insights. I saw your hand was up, Dr. Mpanga Kasonde. You can go ahead, sir.
Thank you very much, Nyasha. Like I said, yes, Mpanga here from Zambia. Great presentation indeed, and great insights. And I think that in thinking around the actionable, steps and some of the solutions into the sustainability of the supply chain, as well as equitable access to genomic sequencing reagents. Just to share reflections, I think critical, like mentioned earlier from the presentation, I think policy-wise at regional level, I think there's incredible progress that has been done, stemming away from the WHO giving that, global strategy in terms of implementation of genomics, surveillance, as well as, the Africa CDC. I think they've done a great job in terms of providing some strategic documents and frameworks that really guides on how, genomic surveillance can be used and applied in terms of public health. But I think that going beyond that, the next step really from regional to national level is now, I think, the strategic policy or strategy adoption at country level, which then will ultimately stem and spell out the buy-in in terms of which country has adopted this. So we need at country level to have policy guidance, just as we saw from the HIV and TB, that there was a policy adoption both at regional and country level. So we need countries to put up and prioritize genomics surveillance into the routine surveillance. So really, it's a policy statement, policy guidance at country level that spells out the adoption or integration is a better word actually. Integration of genomics into sequencing, into the routine work, and supporting the various priorities for the country perspective. I think once that is done, where genomic sequencing, is integrated in the country priorities, I think then it spells out a very clear way and path in terms of, within the lab networks now, it will be easy for us to know what the priorities are, what pathogens are they focusing on as a country, and then because then what are their top priorities, for example, as far as public health is concerned, what use cases will be, in which genomic surveillance will be adopted. So I think once we have those spelled out at country level and within the countries, where, for example, a particular genomic sequencing is adopted, the country adopts to say, well, at global level, this has been, for example, they targeted the WHO guidance on TB. And we have countries begin to buy that in, for example, when they are doing the national TB action plans, that also, is incorporated. When they are doing the national lab strategic, documents, we have genomic surveillance, genomic sequencing being incorporated, within those strategic documents at country level. And I think that then puts all priorities to focus and include and integrate genomic sequencing within the workspace. But again, at what that would do, I think at operational level, we then need to have, these use cases that have been adopted and prioritized at country level to then be, aligned with the lab planning, the laboratory plannings, and all the lab plans. Then we will have, genomic sequencing embedded there. Once that is done, I think then it will be easy for the labs, and in this case now engaging with the manufacturers and distributors, to provide that, look, we have this need within the country for genomic sequencing because we have prioritized HIV, we have prioritized TB, we have prioritized, bacteria, we've prioritized AMR surveillance, whatever the priorities are for the country. And that will be used to, compile the country need, country volume needs. And as they approach, the suppliers, then they could say, this is our need and our demand as a country to meet, because we need to be doing these test volumes at country level. And then conversations with the suppliers, and I think some of them are here, they will be able then to go into, I think, very, very important discussions that will be here, will be on, an all-in-one, I think as Newton put it, service level agreements, where we agree in terms of, servicing contracts, in terms of even considering placements of some of the machines, which are quite pricey when you do a one-off procurement of a given sequencer, and you have 3-4 years later a new model is in place. So that becomes a huge cost, for the and then manufacturers are now giving the end user support license, that they are ending the support for a particular instrument. So I think that also, once the need is generated, the volume that a country might need, aligning with the priorities at country level, then you could approach the manufacturer and say, can you consider, for example, placing maybe a particular sequencer in our country that's able to handle this volume, and we will be able to procure reagents on a rental basis for equipment, as well as a given number of volume of tests to be done and sequences to be generated. That can easily be projected. So I think having those conversations with the manufacturers, where you can even begin to throw in, if manufacturers and distributors can throw in ideas around placements of equipment, also the open access reagents, where you are not tied reagents, some of the reagents that can be used across platforms, those also conversations can be had with the manufacturers and the laboratories. But I think that in terms of prioritize and getting this going first, we need to countries to adopt these policy guidances and strategies at country level, and then align this with country priorities, and then that way it will be easy for us to predict, or to kind of have an idea in terms of the volume and the need of the capacity that will align to meet the demand for the country. And then it will be easy to engage with the manufacturers in terms of how they can come in to support the markets. That's my thoughts. Thank you.
Thank you very much, Dr. Msonda. So I wanted to check this specialized equipment, can it be multiplexed so that maybe it can do other tests in the laboratory? Like instead of us still doing the microbiology, separation and so forth, is it something that we have seen in the pipeline, where probably the manufacturers or these equipment can be adopted to do other tests, like substituting other wet lab procedures? I saw Mr. Anafi Mataka is in the house. Do you want to give us some insights around that? Is there any potential of this very important equipment to be multiplexed and probably replace other wet lab procedures in the laboratory as a way of probably having more value for money for this important equipment? Or they can only be used just for sequencing for the use cases? Or we can, like, add some other tests or replace some other long tedious procedures in the laboratories? Is it something that has been discussed, or is something that can potentially happen, say?
Yes, Nyasha, as we wait to hear from Anafi, please, I've dropped you in your inbox some of the questions that have come from colleagues. Please, you can share for discussion. Thank you.
Yeah, so Nyasha, even as Nafi is coming in, I think in terms of thinking about multiplexing, I think an idea is how I think the Illumina team, which I'm sure maybe they're here, they could speak more about that. They have these products, they call it the IMAP, where all the components for sequencing in terms of wet lab preparations are there. And all you need is to put specific primers for the specific, pathogen that you are interested in. And I think that's one way to get started with. So once I procure that kit, I can use it for HIV. I can use it for bacteria, until all I need is just the specific primers for the particular pathogen that of my interest. But the whole kit really has been designed. It has all the components that you need for your wet lab library preparation, and all you need is to add in your specific primers for a particular pathogen that you're interested. I think that's a good start in terms of thinking around multiplexing, because then I could decide, to combine primers in however way I want to achieve my particular, target in terms of sequencing that I'm interested in. Over to you.
Thank you very much. So from the chat from Julia, this one is directed to Trevor. I think when you give your insights, so it goes, do countries have clear policies on priority use cases and targets for the number of sequences needed? Are any countries using domestic financing to achieve these goals, or is funding totally unpredictable or grant dependent? So I will give this to Trevor. I also saw my brother is in the house, Dr. Francis Chikutse. You can also come in after Trevor's response. Over to you, Trevor.
No, thanks for that. It's an important question. I probably don't have the perfect answer to it, and I think there are some members in the room today that may actually have better responses here. But what I will say is, as I mentioned earlier, the genomic sequencing space right now is a new space. The technology has been around for a while, but its use in the past has been very focused on certain use cases, maybe research, maybe certain targeted surveillance for certain diseases. But through COVID, of course, we have learned that its utility is much broader, and a lot of capacity has been established. And we're now, as a community, really starting to explore how this technology can be much more broadly used. And the use cases are just expanding, all the time. We know that across a number of different epidemic-prone diseases, the use cases are there, and that's growing. And then clinical use cases are becoming stronger. It's there now for TB, with strong guidance from WHO, and we can expect to see broader use cases, AMR, other infectious diseases, etc., to come on board. So what do I mean by that? What I mean is that we're still undergoing it's a growing space. And right now, procurement has been driven by certain use cases, not all of these, but certain use cases that are really driving most of the use. I would hazard a guess that I think a lot of the procurement, the buying of genomic sequencing supplies right now is externally donor supported. Although in some countries, there may actually now be national programs and institutes that have intrinsic funding, national funding, for either research or for epidemic disease surveillance or for clinical purposes, that are now coming online, funding that's coming online and starting to procure these technologies. In any case, that's the direction to go, to have strong endogenous funding, domestic funding, supporting labs and institutions to run their genomic sequencing programs. Of course, I think there will always be some donor funding, which is important and useful, and we'll see how that develops over time. But the overall pattern, I think, is still a little unclear because there may be a lot of different buyers, lots of different labs, so a lot of uncertainty as to what is being procured. And I think providing clarity around that, and really as a community coming together to establish that clarity as to, okay, what are we buying? What are the main use cases? What do the volumes look like? It will be very valuable for this community to understand, and then to see what are the main use cases that are growing, for others to learn from others about, okay, what are some of the best practices and so on, and to see how we can grow moving forward. But that's my high level answer to that. But I'm sure there are others who actually are much closer to the national procurement processes who can share more.
Thank you very much. Thank you very much, Trevor. Francis, are you able to speak? Dr. Francis?
Yes, Nyasha, thank you very much. Might now shed more light on the work which we are currently doing at Africa CDC to expand genomics in the continent. So we have realized that there is a lack of policies, especially for genomics. And also we are aware that policies, they take time to develop. So what we are doing now is we are assisting in supporting member states, offering technical support and financial to develop their national genomic strategy documents. And I think so far we've worked with 16 countries, and some they have launched, and 90% of them they've now finalized and they are waiting launching. So within these national strategies, there are key areas, and supply chain is one of the key areas, in addition to in terms of the capacity, whether the infrastructure or workforce, as well as issues around, like Trevor said. What we are advocating is also financing, domestic financing, however small it may be, because in the end, we want to have genomics embedded within the routine surveillance of these member states. So another key also area is prioritization of pathogens and use cases. And I think this also is also within the within these costed national strategies, because so this country now, they now have these documents which they can able to share. And they've got a clear implementation plan with all activities which are costed. But coming on to supply chain, what has come out in most of these member states is the issue of customs. Sometimes, even with countries where there's exemption of these laboratory commodities, then the process is cumbersome. It may take up 2 to 3 weeks, whilst maybe the reagents are at the airport. So these are the things now we have also encouraged when we have this workshop, to encourage now the guys from even other ministries, key ministries like finance, is also ministries involved these customs, so that the discussions, they can start at that level. And then when they implement these national strategies, one of the activities is also to have meetings, more meetings with customs until they arrive. And then they also realize the importance of genomics in routine surveillance. So these also national strategies, they cover a broad range of priority areas, like also QMS is also well covered, as well as issues doing with also data governance, be it the analytical part, the access part, as well as issues around storage, and also even issues around even connectivity, internet connectivities. These are some of the things when you engage member states, they don't usually mention, but these are the key areas which also needs to be accosted and also addressed in their national strategies. So yes, each country has got a list of its own priority pathogens, ranging from pandemic-prone diseases. AMR also is a key feature there. And also diseases like HIV, malaria, drug resistant, for example. And I think also one of the low-hanging fruit which is coming out clearly is the implementation of targeted NGS in drug resistance tuberculosis in most of these member states. And then there are a set of costed activities like the setup of it, the needs assessment and capacity evaluation. What capacity do these countries have? And also the piloting, assessing the performance, capacity, and feasibility up to the integration stage into existing public health programs, as well as after the integration, the scaling. How do we expand it nationally, and also sustainable implementation into a level where NGS is embedded in routine surveillance and also sustained use. So yes, this is in a nutshell, these are some of the work which we are supporting member states with other key partners at country level. Thank you, and over.
Thank you very much, Dr. Francis. From Mashe, we also, he was saying, is it possible to strengthen basic microbiology tests as we approach genomic sequencing? In Africa, only 1.4% labs do basic bacteriology culture based on the studied sample size. So I think this has been partly answered, but again is a challenge to all of us, how we can improve this and how the new technologies can cover this. So the presenter may also answer this, but I want to give you another question, Newton, that is coming here from Ali, who says, great presentation, Mr. Newton. What are your thoughts on capacity building for local manufacturing for genomic reagents and consumables? So if you could take that, then I will give you the last one. Should Africa invest in personalized genomic medicine or prioritize expanding access to basic healthcare for all? This was from Hassan. Over to you, Newton.
Thank you. Thank you very much, Nyasha and colleagues for the questions. Local manufacturing post-COVID is something that is being seriously considered. I am not sure at this stage local manufacturing for genomic sequencing is something that we can seriously discuss, because adoption and utilization, as Trevor and Francis have already mentioned, is in the early stages, and a lot of work is being done to scale up. I think at this point, local manufacturing for genomic sequencing might not be a significant priority or on the table, as compared to other issues like policy adoption and increased utilization. I hope that addresses the question. The second question, Nyasha.
Okay, the second question was, how can we, it was from Mashe, it was in Africa, we only have 1.4% labs doing basic bacteriology culture. Is it possible how can we strengthen basic microbiology tests as we approach genomic sequencing? And of course, the other one from Hassan was, should Africa invest in personalized genomic medicine or prioritize expanding access to basic healthcare for all? Thank you.
Thank you very much for the kind reminder. With regard to microbiology, I think a significant work is already being done within the ASLM with a similar, with a different project, but there are opportunities to consider genomic sequencing applications, as mentioned. Dr. Chikuse mentioned AMR is one of the significant priority areas that they are looking at in terms of expanding the use cases for genomic sequencing. With regard to personalized medicine versus universal coverage, I would defer to other colleagues to respond to this. For example, because the current immediate priorities for us is to ensure that we improve access to and coverage of safe and quality diagnostics. If you refer to the Lancet Commission on Diagnostics, there is poor coverage of diagnostics, especially as we go lower down the health systems. So technologies that can easily be deployed at the point of need would be a priority at this point, because that's where we also have the greatest burden in terms of morbidity. So that would be my response to that particular question. But over to you and other colleagues to chime in on this. Thank you very much.
Thank you very much, Newton. Julia also asked, is there good data on cost effectiveness of genomic sequencing for different use cases to inform policy development and resource mobilization? I think the main question here is how much sequencing is needed to be impactful. Francis, do you want to take this briefly as we approach the last 10 minutes?
Sorry, Nyasha.
Yes, can I come again?
Yes.
There is a question to say, is there good data on cost effectiveness of genomic sequencing for different use cases to inform policy development and resource mobilization? How much sequencing is needed to be impactful?
Yeah, so I think the answer is yes and also no. For yes is, there's a lot of genomic data which have been developed for other priority pathogens and also use cases. I'll give malaria, for example. There has been a lot of data developed, generated within the mainly research institutes and academia in Africa. But the key challenge is each country is using different assets according to the requirements of the funders. And now, regional analysis now, to find the cost effective of genomics, for example, drug-resistant malaria as a use case is a challenge. And even at country level, there might be different, each institute is using different assets. And most of these, they are not for public health decision-making. So what we have realized is, we know that the data is already there, but we are trying to find means and mechanisms to make sure that at least we have some regional analysis of the data which has been generated. We are doing the same for mpox. I think we have up and coming workshop for the regional analysis for mpox data which have been already generated. So yes, it's still a work in progress, but we are also trying to, we are aware of these challenges. For example, with malaria, drug resistant, diagnostic resistant, as well as insecticide resistance as use cases. We are trying to develop a target product profile, like the one which is used for TB. And then from this, we are going to use a simple and scalable assay, which can be used in member states. And from that, we expect now to regional analysis to be conducted. And we are also, another area which we are focusing is development also data standards, you see, and also in terms of harmonization of protocols. So yes, it's still work in progress, and we are aware of these challenges, and we are also addressing them case by case. So like I said, the answer is yes, and also the answer is no. I hope I have managed to answer that. Thank you, Nyasha.
Thank you very much, Francis. I can't see, is there any other hand that is up? Someone who wants to speak? Suva, is there any hand that is up?
No, at the moment, no. At the moment, no. Thank you.
This was just a comment from Komoto. Thank you, Newton, for the presentation. I do agree we need to push for policy change to move genomic sequencing towards routine testing. And for this, we need to carry out investment case both at national and regional level. If there's no other comment from your side, I think I will give back the remaining 5 minutes. I really want to appreciate your attendance, everyone. Thank you very much for attending this important session. We will send out the recording, we will send out the notes as usual. Please feel free to send any questions to the Secretariat, and we'll send out the notice for the next session that is going to happen week 4, June 2025. Thank you, everyone, and I'm giving back the remaining minutes. Thank you.